हेलो फ्रेंड्स, हाउ आर यू? कैसे हैं आप लोग? आज हम न्यू टॉपिक स्टार्ट कर रहे हैं जिसका नाम है जेड एन स्टेन, जिसको हम जेड एन स्टेनिंग कहते हैं. जनरली दिस इज फॉर ट्यूबरकुलोसिस. दिस इन्फेक्शन बिलोंग्स टू ट्यूबरकुलोसिस. ओके, so what we are going to read today, we will read the important aspect of ZN staining. मीन्स कि ZN stain में क्या क्या चीजें होती हैं, उसकी गाइडलाइंस क्या इंपॉर्टेंट है. सबसे इंपॉर्टेंट ये है कि जो भी हम ZN स्टेन पढ़ते हैं, अपन कुछ भी पढ़ लेते हैं, तो दैट इज नॉट इम्पॉर्टेंट. सो इम्पॉर्टेंट थिंग इज देयर आर टू गाइडलाइंस. एनटीपी गाइडलाइंस जो अपन इंडिया में फॉलो करते हैं, WHO गाइडलाइंस. तो उसमें डिफरेंस क्या है, व्हाट आर द मेजर डिफरेंसेस इन दैट, वो सब अपन इस चैप्टर में पढ़ेंगे, अपना सारी चीजें करेंगे. तो आपको बिल्कुल क्रिस्टल क्लियर हो जाएगा कि ZN स्टेनिंग क्या होती है और कैसे करना है. सो लेट्स स्टार्ट. सो फर्स्ट, this is how the ZN microscopy looks like. Okay, so this is the complete picture of your microscope. So under oil immersion, what you are going to see, you are going to see this one. So look at that, these are the blue background and these are your red thin bacilli. So how we pronounce it, we pronounce it as a red thin beaded bacilli. Okay, so these are your acid fast. So look at these aspects, look at these bacilli. This will be red or pink. Look at this one, this is the specific beaded one. So this is the second slide showing what are the bacilli. Look at these are your red bacilli. These are your red bacilli, and this blue is a background, just remember that. And these structure are your neutrophils. Okay, so this is what, this is a picture of sputum. Okay, so this is your NTP guidelines. Now we are going to talk about NTP. Full form is National Tuberculosis Elimination Program. This is very important for Indian scenario. So what are the different stains we are using? First of all, you need to understand the primary stain what we are using is the carbolfuchsin. Okay, so the important thing is the carbolfuchsin we are using it is the heated carbolfuchsin. You have to heat the carbolfuchsin and then you have to put on your slide. So this is a slide and this is your smear. So you will put carbolfuchsin, heated carbolfuchsin on the slide and you have to put it for 5 minutes. 5 मिनट तक आपको रखना है उस पे. उसके बाद क्या करना है, then after 5 minutes you have to clean it with the water. Then you have to use decolorizer, 25% H2SO4 decolorizer. Remember that the decolorizer we are using for NTP is 25% H2SO4. We have to put it for 2 minutes. Okay, fine. Then what we are doing, we are giving the counter stain. After 2 minutes we have to use the counter stain. The counter stain name is methylene blue and you have to put it for 1 minute. After that you will see under the microscope what you are seeing these kind of bacilli. Okay, fine. So on the basis of this microscopy, we in the future we are grading the TB bacilli. We will do the grading. हम grading करते हैं इसकी कि किस ग्रेड का है. ग्रेडिंग क्या बताता है आपको? तो फर्स्ट ऑफ ऑल इट विल टेल्स कि द डेप्थ ऑफ द डिजीज द पेशेंट इज हैविंग, व्हाट काइंड ऑफ डिजीज, इट्स द लीथल वन और द माइनर वन. सो दिस ग्रेडिंग विल टेल यू दैट. एंड द सेकंड इंपॉर्टेंट थिंग इज कि आफ्टर ट्रीटमेंट, फॉलोइंग ट्रीटमेंट, you will see the grading कि whether this grade is going up or going down. Okay, so the second important thing is this is your stain. Okay, then the second important thing is कि why we are heating these carbolfuchsin. So first of all we are heating this carbolfuchsin because the carbolfuchsin, what it will do, it will just penetrate the cell wall of your TB bacilli, because the cell wall is composed of your mycolic acid. Mycolic acid is a very thick structure. So after heating, this stain will go inside your TB bacilli. Then the second, why we are using this decolorizer. The decolorizer, what it will do, it will remove stain from non-acid fast bacilli. So जो भी bacilli हैं जो acid fast नहीं है, उससे ये remove कर देंगे decolorizer. लेकिन आपके जो प्राइमरी टीबी बैसिलाई हैं उसको ये डिकलराइज नहीं कर पाएंगे. लेकिन जो टीबी बैसिलाई नहीं है, दोज व्हिच आर नॉट टीबी बैसिलाई, दे विल जस्ट रिमूव द स्टेन. देन वी विल डू द काउंटर स्टेन. सो काउंटर स्टेन, द कंसेप्ट ऑफ काउंटर स्टेन, व्हाई वी आर डूइंग इट, दोज नॉन टीबी बैसिलाई will take these counter stain. Your TB bacilli are not going to take this counter stain. सो काउंटर स्टेन का क्या फायदा है कि वो जो बैकग्राउंड है आपको, वो बैकग्राउंड कॉन्ट्रास्ट रखता है। तो ये आप देख रहे हो, ये ब्लू कलर के जो बैकग्राउंड है, these blue color backgrounds are due to these counter staining. So in the counter staining, the blue background, the red bacilli, you can see it easily. This is the concept of all this ZN staining. Okay, fine. So what are the changes in the WHO? First of all, the primary stain in the WHO is same, but the important aspect is your decolorizer. Here we are using 3% acid alcohol, and you have to put it for 3 to 5 minutes. There we are using it. Here in the NTP protocol we are using it for 2 minutes, but in the WHO protocol the decolorizer is different, 3% acid alcohol, and we are using it for 3 to 5 minutes. 3 से 5 मिनट तक रखते हैं, and then the counter stain is same. So the basic difference is your decolorizer. So the same again, the concept is same. The primary stain will stain your AFBs, then decolorizer will remove the non-acid fast bacilli stains. So counter stain your AFBs, or the background will take this counter stain, your acid fast bacilli will not take the counter stain. Okay, fine. Then after that, this is the picture. This is the whole picture you are going to see. So what are the basic differences? Here we are using 3% acid alcohol. So what is the composition of this 3% acid alcohol is 3% HCl we are using and 95% ethanol. Here we are using. In the NTP we are using H2SO4, but here we are using 3% HCl and 95% ethanol. Okay, the grading will be same. So why the WHO is saying that you should use these 3% HCl and 95% ethanol? First of all, the important thing is that you will have a better picture in comparison to the H2SO4. The picture will be sharper and the background will be more clear, so that you can easily see your acid fast bacilli. So here the mnemonic is 3:3:1. 3% decolorizer for 3 minutes and 1 minute counter stain. Okay. So how we are doing the grading after seeing the acid fast bacilli under ZN microscope? Okay, fine. So you need to understand one thing. What is the one thing? This is your slide, okay, and this is your smear. If you go from this one edge to another edge, this is your approx 100 field. Okay, now the whole story will start. अब ये आपको सारी कहानी यहाँ पे शुरू हो रही है। तो इसमें क्या है कि if you are not going to see any bacilli from one edge to another, means your slide is negative. Okay, fine. Then if you are able to see 1 to 9 bacilli in this 100 field, it is scanty. If you are able to see 10 to 99 acid fast bacilli in these 100 field, then you have to score it as a 1+. If you are able to see 1 to 10 AFB per 50 field, then it is 2+, and then greater than 10 AFB per field in 20 field at least, so then it is 3+. So one mainly आपको 100 फील्ड आपने देखने हैं, एक एज से दूसरे एज पे जाना है, एंड उसमें ये देखना है कि अगर 1 to 9 है, 1 से 9 है, तो देन यू विल गिव स्कैंटी. इफ 10 to 99 है, तो देन यू विल गिव 1+. इफ हर फील्ड में आपको 1 से 10 दिख रहा है, किसी फील्ड में 10 दिख रहा है, किसी में 8, किसी में 9, यू आर नॉट गोइंग टू सी मोर देन 10 इन एनी फील्ड, बट इट इज बिटवीन 1 to 10. So you have to check for 50 field at least. At least you have to see the half of this length. So if you are seeing it, grade it as a 2+. If you are seeing too many bacilli, unable to count more than 10 in every field, so at least you have to see at least 20 fields like that, and then you have to score it as a 3+. This is all for your ZN staining, and this is very important, and this is very factual, and you have to read it and you have to learn it. And the most important thing कि अगर practical कर रहे हो, कोई अगर UG student है, he or she is in second year, so do the practical under your this practical class. This ZN staining is very important, you have to perform. And अगर कोई MD student है, तो they have to do. Okay, and this is very important for infectious disease personnel also, because infectious disease personnel belongs to, could be medicine people or pediatrics or microbiology. Microbiology know all this stuff, but for the pediatrics and medicine, this is a new one. So just remember these facts and try to do it practically. Okay, thank you, bye bye, take care.